India's festive season is underway as millions of people gather for religious festivals, often without any protective measures against COVID-19. Health experts fear these mass gatherings could turn into superspreader events.
I can find many people are moving without a mask. They are not maintaining the social distancing.
I am feeling happy. Though the crowd is excessive, I am sweating like hell, but still I am enjoying.
Same time last year, infection numbers spiked with hundreds of thousands of new cases each day. I'm Ben Fazul, nice to have you along. Anyone who's been to India knows festivals mean masses of people, and with it, a risk of infections spreading. After a brutal second wave and a bumpy vaccination rollout, close to a third of the population is now fully vaccinated. That's enough for many in India to join in the festivities.
The victory of good over evil. That is one of the key themes around the Hindu festivals of Dussehra and Diwali. And these Delhi residents are clamoring to leave the evil of the coronavirus behind. Celebrations are meant to be low-key. This is the only traditional Dussehra performance allowed in the capital this year. And the audience is strictly limited. But that isn't holding these crowds back. Nor are people shying away from busy festive markets. Restrictions in shopping districts have been lifted completely. And COVID-appropriate behavior isn't being enforced. For many here, their confidence stems from the vaccine.
I've gotten my second dose, so now I feel a lot more comfortable about being in public places.
The cases are low right now, so our hopes are high, and vaccinations are going well.
For the lucky few who have been allowed into performances like this one, it is the closest they've felt to normalcy since the pandemic began.
I think more excited than scared, because it's been such a long time that we've been able to do anything like this.
I miss the crowds, the food stalls and the swings, but I'm still really glad we got to attend this.
The head of the Delhi government also reinforced a message of hope.
I pray that we defeat the demon of the coronavirus soon. That God keeps all of you healthy and free of disease.
As Lord Ram kills the demon king Ravan, the euphoric crowds momentarily forget about the pandemic. But it may yet be a long wait till the threat of the coronavirus too goes up in flames.
Rajiv Dasgupta joins us now. He heads the Centre for Social Medicine and Community Health at JNU in Delhi. Nice to have you on the show again. As we saw there, celebrations underway and people having a great time. But tell me, what do you think? Only around 30% fully vaccinated. How risky is that for these people?
Hello, Ben. The visuals of the Durga Puja that we saw, particularly if we talk of West Bengal, which has certainly witnessed a rise in cases, the outcome of that surge would depend on an interplay of two things. The zero prevalence, the zero positivity in West Bengal by the last fourth national zero survey, which is relatively low at about 61%, and coverage with two vaccines, which is also relatively low at about 27%. So a state like West Bengal, with both the parameters being low, would certainly be at additional risk. What could perhaps be protective, and that's something we would be able to gauge fully in the coming weeks, is how much protection a single dose of vaccine is according, because West Bengal has about 72% coverage with a single dose. And that would really entail what proportion would actually fall sick from the COVID and how much this current surge would last.
So where would you put the likelihood of another surge of cases then?
Given the very high levels of seropositivity in most Indian states, and in fact, the more recent ones which have come out in the last 2 weeks, state-specific ones, actually show that seroprotection is pretty high as a combination of both vaccination as well as disease, both clinical disease and asymptomatic disease. So That's protective presently, but should there be a new variant, or particularly a new highly transmissible variant, that could certainly change the complexion of the game.
And what role might natural immunity play now that so many Indians have caught the coronavirus?
Well, cases are currently at a low of about 12,000 to 13,000. The deaths may seem a bit disproportionately high compared to the new cases, but that's because several states have reviewed the data, reconciled the death data, and therefore there have been some new death notifications, but they are not new deaths, so to say. So therefore, at present, it's seemingly a comfortable situation, but that owes a lot to the high seropositivity.
And we heard in that report a confident young man saying that lots of people have now been vaccinated. I mean, we're talking about what you said, 27%, 30%. And India recently administering its 1 billionth coronavirus jab. I mean, are people getting overconfident?
The 1 million jab is certainly a very creditable feat. I think what we need to be worried about is roughly half a dozen to 8 states which are below the national average. These are very large states with very large populations. One of the largest states, Uttar Pradesh, for example, has 20% of the population covered with 2 doses. A state with high incidence, Maharashtra, which has Mumbai city in it, has a coverage of 32% with 2 vaccines. So these are the states that we need to look out for. On the other hand, the states which have really had high coverage, above 50% and nearly 60% in some of the smaller states. So it's a very mixed picture. We really need to keep a lookout for some of these very large states.
Rajib, one thing that India hasn't been battling is vaccine hesitancy. A lot of countries are struggling with that. Why is India doing so well in getting people to actually take the vaccine?
We need to give credit to perhaps 2 things. One, certainly the forthright conviction of the present government in putting its full weight in the vaccination program. But secondly, what we also need to pay tribute to is a systematic strengthening of the immunization program in the context of polio eradication. And this current phase of strengthening or systematically strengthening has been going on for the last 2 decades, once the 2000 milestone for polio eradication was missed. So the current the current campaign has come on very strong fundamentals, and that's what is really paying dividends. It isn't that there haven't been cases of hesitancy, but the campaign has also been proactive about it. But we certainly need to recognize the strong fundamentals.
Rajib Dasgupta from JNU, thank you very much for being on the show today.
Thank you.
Another viewer question now from Derek Williams, and this time a question on the COVID-19 vaccine.
Why do I need a COVID-19 vaccine if it doesn't prevent me from catching the disease?
I think that this question, more than any other, illustrates how governments and healthcare authorities have really struggled with messaging in this pandemic. To answer it, let's go back over some of the stuff that they could have probably communicated better. First, I think, is the fact that despite really great efficacy numbers from clinical trials, the vaccines that we have are not perfect silver bullets, and we should never have expected them to be. What they have so far proved to provide is some very effective short-term protection from serious illness and death caused by COVID. It would be great if that protection were indefinite, but there are indications that it might be less long-term than we'd hoped. One recent model-based study that's gotten some attention posits that if SARS-CoV-2 becomes endemic, then reinfection in people who got it once could on average occur again in just 16 months. Now, if correct, That obviously has implications for durability of immune response in vaccinated people as well. But that's just one prediction. And over the course of this pandemic, it feels like those have proven wrong a lot more often than they've proven right. So I would encourage people to focus more on what we really do know now, like the crystal clear data-based statistics published by the CDC in the US. They've showed that although vaccines haven't prevented COVID-19 or its spread completely there, unvaccinated people are still 5 times more likely to test positive for the disease than vaccinated people are. And more importantly, unvaccinated people are 10 times more likely to end up in the hospital and 10 times more likely to die. So does being vaccinated guarantee you won't get COVID-19 or maybe even die from it? No. But for at least a while, maybe a long while, vaccines certainly do stack the deck a lot more in your favor.
And you saw the celebrations from India earlier. Let's leave you with preparations for Sunday's Day of the Dead parade in Mexico City. It was cancelled last year due to the pandemic. Authorities only gave the go-ahead at short notice, artisans rushing to put together their floats and costumes and masks. The parade is not an ancient tradition. It was actually inspired by the 2015 James Bond movie Spectre. But the ideas caught on. Last time around 3 million people took part. I'm Ben Fazul, and thanks for joining us on another COVID-19 special.